California. To Dr. Galley, who you'll hear from in a moment, a father of 4, to so many members of our staff that are looking forward to our children getting back to school, getting quality education, and allowing us as parents to get back to work where we are able to, and to make sure that we're attending as we anticipate this time every year to so many other responsibilities as parents and caregivers. So today I want to talk about what we're putting out in terms of guidance and guidelines for education in the state of California in the context of COVID-19. We'll go through a list of specific recommendations, specific guidance, as well as updating you as we do on all the latest information relating to positivity rates, hospitalization rates, and ICUs here in the state. Let me begin first with a foundational framework, and that is our bottom line. That learning in the state of California is simply non-negotiable. That schools must, and I underscore must, provide meaningful instruction during this pandemic, whether they are physically opened, the schools, or not. And that's what I want to talk about specifically today. Our students, our teachers, staff, and certainly parents, we all prefer in-classroom instructions for all the obvious reasons, social and emotional foundationally, but only if it can be done safely. As a parent, I believe that as someone that has a responsibility to help support the education of 6+ million kids in the state of California, I have the backs of our staff, our teachers, our school nurses, our counselors, our guidance staff, principals, bus drivers, janitors, all the folks that are responsible for the caretaking, the safety and the health of our children. We have to have their backs as well, including, obviously, the preciousness that is our children and the kids in our education system. But safety is foundational, and safety will ultimately make the determination of how we go about educating our kids as we move into the fall and we work our way through this pandemic. Here is the 5 principles that we are laying out in terms of our expectations. Here is our pandemic plan for schools in the state of California. Number 1, safe in-person school, based, again, if you're going to be in person in the school, based upon local health data. And I'll walk through that bullet point in more detail in a moment. We have new mask requirements that we are putting forth today, some clarification and some constructive guidance on physical distancing and other adaptations that we expect to see within the school setting. We're putting out specific guidance as it relates to testing and contact tracing in our school system, and what we mean by distance learning. And the word rigorous is foundational. If we're going to have distance learning, and we will, to make sure that it's real, that we address equity, we address the divide, and it's quality, it's rigorous distance learning. Let's talk about number 1. Using data, using the foundational data that we have laid out county by county all throughout the state of California. We are now putting forth guidelines that say schools can physically open for in-person education when the county that they're operating in has been off our monitoring list for 14 consecutive days. If you've tuned into these daily briefings, you're very familiar with our monitoring list. I'll be updating that list later in the presentation today. But we are now putting forth guidelines that say, based on the data, based upon the background spread, the community spread of the virus, that if you are not on that monitoring list, you can move forward as a county if you choose to physically open your campus, physically open your schools. However, schools that don't meet this requirement, they must begin the school year this fall through distance learning. Number 2, and I'm going to get to that in a moment. Number 2, we're putting forth a new mask requirement in the state. All school staff and students, all staff and students in 3rd grade and above must wear masks. Students in the 2nd grade or below, we strongly encourage wearing masks and face shields. I have a very young son, Dutch, and caregivers, when he first saw masks, he naturally recoiled. A lot of caregivers now have face shields, and he can see their expressions, their humanity, and that's why we put specifically guidance out as it relates to not just masks, but face shields as well. Our third frame of guidance that we're putting forth today is around physical distancing, and as I mentioned, other adaptations. So on the physical distancing side, we believe that it's incumbent upon staff to maintain at least a 6-foot distance between each other and a 6-foot distance between themselves and the students. We believe that the school day should start with symptom checks, meaning temperature checks. We have robust expectations around hand washing stations, sanitation, deep disinfection efforts, and that these schools have, along the lines of the adaptations, have quarantine protocols. And we'll talk a little bit more in a moment about these continuity and attendance plans that each school site is now responsible for putting forth. As it relates to the issue of testing, there's a requirement that we test on a rotating basis a cohort of staff on a consistent basis. Dr. Galley will talk a little bit more about that. And in turn, we are bringing to the school system the benefit and support of the 10,000+ contact tracers that we have trained here in the state of California in partnership with UCSF and UCLA with a backbone and a database that now has organized a collective. We want to turn our contact tracing where we think it become very effective in these school environments, could be very effective in mitigating the spread and trying to understand exactly where and how the spread had advanced, and allow us obviously to isolate and quarantine cohorts of not only children but staff as it relates to mitigating that spread further. As it relates to distance learning, as I said, rigorous. Access to devices is one thing, and connectivity, it's foundational. And in a moment, I'll talk about the money we have put up to allow for districts to purchase new devices to get the kind of connectivity that our students need and deserve to address this yawning gap as it relates to the digital divide. We want daily live interaction with teachers and other students. Students connecting peer-to-peer with other students, teachers connecting daily on an interactive frame to advance our distance learning efforts. Remember, we had a lot of experience that came through the spring this year. We reviewed a lot of the fits and starts related to quality, access issues, points of consideration and concern. We shared a lot of those best practices. No one is going to deny that based upon the early orders to start to close schools at the local level, that some of it worked more effectively in certain parts of the state than others. Clearly, we have work to do to make sure that we are doing rigorous distance learning, but this is the predicate, the foundation. These are the expectations that we have, minimum expectations in terms of quality, engagement, connectivity, and access to the devices that are foundational in terms of providing for quality distance learning. We also want to create a challenging environment where assignments are equivalent in terms of what you would otherwise get in an in-person class setting. I'm not naive, and again, we stipulate, that second slide I showed, that staff, that teachers, that parents prefer the socio-emotional learning of in-class education. That is a default, that's our bias, but under the circumstances with the spread of this virus, and I'll get to that spread in a moment as an explanation again as to why at this moment we're putting out this recommendation, that we want to do our best to create some sense of equivalency with the obvious constraints that is distance learning. We also want to make sure that we are always mindful of our students that are homeless, our students that are foster care kids are in the system, kids with English as second language, and those with learning disabilities, those that have special needs and the like. Look, that foundation is laid, and was laid, rather, with the legislature and the strong support we received from the legislature when we put forth a package on equity that was approved. That package includes $5.3 billion to deal with learning loss that was associated with some of the closures last year, and a very, very focused and intentional effort to meet the needs of those, again, that fall into those categories of special needs in our system. So $5.3 billion was put in additional funding to prioritize the issue of equity. So it's not just a throwaway line, it's not just a catchphrase, it's not just something we put out to promote a point of view, but we're substantively putting real resources and heft into advancing that point of view as well. So the question a lot of people are asked, or rather begin to ask, is, all right, once our school is open, what happens if the spread goes into the classroom setting or in a district setting, or if the spread continues in the county unabated? And so this slide puts forth some criteria that we are setting forth. Again, these are brackets. And within these brackets, we'll work through with the county and all the local conditions and recognizing the nuances and the gray areas that are part of a system as large as ours, over 1,000 school districts here in the state of California, in addition to all of these county superintendents and all of these local districts and cities and counties and all the jurisdictional criteria. It makes this, unlike any other state in terms of size and scope, challenging. But nonetheless, here's the minimum expectation in terms of expectation to consult with public health officers first if a classroom cohort has to go home because there's a confirmed case. If a school goes home with multiple cohorts that have cases, or we stipulate 5% of the school, local school, not district, local school is positive, then it would trigger criteria to consider closing, or mandate rather, the closure of that school site. However, one school does not make a district, and depending on the size and scale of your district, this could be multiple schools or just a few schools. If they have similar cohort caseloads, we then have a stipulation here, mandate that if 25% of the schools that compose of a district have positive cases that reach that threshold, that they need to be closed within a 14-day period. So that's the foundation that we're laying out today on public education guidance. As many of you know, we put out guidance to the Department of Public Health, California Department of Public Health, some time ago. There's a lot of local guidance. You have CDE, which is the California Department of Education, that put out guidance as well. The purpose of today is to try to lean in from a health and data perspective in terms of our expectations, public and private schools in the state of California, expectations, mandates with the flexibility that recognizes each part of the state is unique. Each part of the state is distinctive. Some counties are on the monitoring list for a good reason. Others are not for an equally good reason, because they're not seeing the outbreak and as a consequence are able to do the in-person education. But even those that are currently on the monitoring list, we hope and expect as we mitigate the spread of this disease, they'll fall off that monitoring list, and we've created the parameters and guidelines over a 14-day stabilization period to then reopen those schools and allow that as an option to local education entities in partnership and counsel with public health officials to make that determination as to what is best for their children and those that support our children. Remember, public education, education broadly, is absolutely about our kids, but we cannot deny the fact that we have hundreds of thousands of adults that are responsible to taking care and educating our kids as well, and their health has to be considered as well. And I just offer that as a parent, but as someone who has reverence for our principals, for our teachers, for our janitors, for our bus drivers and others. And I am entrusted to be accountable and responsible to their health as well as the health of my children and your children and our children, our future. So that's the framework that we're putting out today on education. Of course, I'll happily answer any questions. And we have the head of the California Board of Education, Linda Darling Hammond, also available on the line for those of you who wish to ask her any questions. And our not only head of Health and Human Services, Dr. Galley, but pediatrician himself is available for questions and can talk a little bit more about his own personal experience with 4 young children he has as well and his expectations moving forward. But first, I want to just quickly run through what I began with, or end with what I began with. Again, that learning remains non-negotiable, but neither is the safety of all of our cohorts of support staff as well as our children. Here are today's numbers. You become familiar with the 7-day average, which to me is even more important than the episodic rise and fall of a single-day number of case counts as it relates to total number of cases that are positive. By the way, we tested 129,000 people on July 16th. You'll see the number, 9,986 individuals tested positive for COVID-19. That 7-day average at 8,838. You'll see the positivity rate has gone actually down modestly, 7.4%. The 7-day positivity rate actually is lower than the 14-day positivity rate. Our current California positivity rate over a 7-day period is 7.1%. The slide you see here represents a 14-day period at 7.4%. We're averaging now 124,000 tests on a daily basis. We have blown past that goal of 80,000. We've reconstituted earlier this week. You heard from Dr. Galley, reconstituted our testing task force. I want to make this crystal clear. Our goal is to increase testing in the state of California, but do so with a different intensity of focus, which Dr. Galley laid out on Tuesday. But I want to see those numbers, those average daily test numbers, continue to climb. They are continuing to climb. This is the largest 7-day average number of daily tests that we've ever put forth. And I'll just remind you, it wasn't that long ago, 100 or so days ago, we're averaging 2,000 tests a day, now over 124,000 tests a day, and we'll continue to fight to see those numbers increase despite all of the external challenges. We'll just have to be more resourceful, and we as a state are more than capable of figuring out how we can navigate some of those supply chain shortages and some of the other constraints that have been highlighted over the course of the last few weeks, and understandably so. So positivity rate, 7.4% over a 14-day period. That represents about a 7.3% increase over the 14-day period, as you can see from this slide. As it relates to hospitalizations, we continue to see hospitalization numbers increase in the state of California, about a 20% increase over, I'm looking now, that's more like 22% increase over the 14-day period. 6,808 individuals now are currently COVID-19 positive patients in our current health system. Represents about 9.2% of the total number of hospital beds now have an identified COVID-19 positive patient. That was about 9% when I shared this slide with you on Monday. So it's increasing, but again at a rate that the current system in the aggregate can absorb. And I'll, in a moment, talk again a little bit more about what we're seeing at the county level. But what we're seeing in the aggregate at a state level related to hospitalizations, not surprisingly, extends to the issue of ICUs, up about 15% over this 2-week period. Now 1,941 individuals that have been admitted into our ICUs, about 16.6% of the total number of patients in our total population, or rather our total asset base of ICUs and NICU beds of 11,711. So that's holding. There's about 16% when I presented these slides to you on Monday. Still north of 10,000 ventilators available, but again, this is in the aggregate, statewide, doesn't represent what's happening at the local level and what's happening at the ground level. That's the purpose of this slide, to talk about the counties on our monitoring list. Now 32 counties, likely 33. We're monitoring one or two others. I expect and anticipate a county or two that's sort of 2 days, likely to be on a third day. Again, though, people fall off, they come back on. But 32 counties currently on the monitoring list. 58 counties in the state of California, 32 counties represented on this monitoring list. That number is held fairly steady, 29 or so last week. At the end of the week, now 32. We started the week around 32. People coming on, people coming off. But these are the counties of most concern. Now, if I broke this down in Stanislaus County and broke it down in Imperial County, what's happening in Tulare County, you'll see a higher utilization in those three counties specifically of ventilators. You'll see other parts of the state like Napa and others that don't necessarily have a lot of remaining ICU capacity.
You've just heard from Governor Newsom with an update on coronavirus and the plan for schools. Our coverage continues right now on CBSN Bay Area, streaming on KPIX.com. The governor says all schools must provide learning in some fashion in the fall, whether it's in a physical building or online. But safety will be at the forefront. He says schools can only open for in-person learning if the county is off the state watch list he just had up. And if that's not the case, they must begin with distance learning. For schools that do open, there will be requirements for masks, physical distancing, along with the regular testing and contact tracing, and even symptom checks. Again, more from the governor now on CBSN Bay Area. Just go to KPIX.com. That's also where you can keep tabs on the changing plans for Bay Area schools. Check out KPIX.com/back to school. Have a great afternoon.